Good morning, good afternoon, good evening, wherever you are. Shared Interest is honored to bring you our third racial justice virtual conversation as part of our commitment to advancing our racial justice resolution approved by the board in 2021. The human and economic toll of COVID-19 is a wake-up call for all of us. A wake-up call to reimagine our response to global health and development that puts the voices and experiences of our most disenfranchised communities at the center of policies and interventions that are critical to achieving true economic, racial, and gender justice. Today's conversation will focus on the unfinished business of achieving an equitable COVID-19 recovery in Africa. My name is Dr. Joan Benson. I'm a public health physician by training with more than 25 years experience in the pharmaceutical industry and global health. In the past several years, my work has largely centered on increasing access to Merck vaccines all over the world, ensuring that people everywhere, no matter where they live, have the opportunity to be protected against vaccine-preventable diseases and also helping save lives. I'm very proud to serve as a member of the Shared Interest Board, and I will be moderating today's discussion. Joining me today are our esteemed speakers. First, Trevor Manuel. He is Special Envoy to Mobilize International Economic Support for Continental Fight Against COVID-19. He served in the South African government for more than 20 years as Minister of Finance and as Minister under 4 presidents, responsible for the National Planning Commission. Also joining us today is Faith Khanyile. She is Chairwoman, Women's Development Business, WDB Growth Fund, and former Shared Interest beneficiary. Last but not the least, my good friend, Ann McMikel, Executive Director, Shared Interest, with more than 20 years experience in global nonprofit leadership and management. Welcome.
Thanks.
Thank you.
Thank you, Joan.
Wonderful. So according to the World Bank, the ongoing COVID-19 pandemic is causing untold human suffering and economic devastation across Africa that could push as many as 39 million more people into extreme poverty. Today, we will focus on the disparate impact COVID-19 has had on small and medium-sized enterprises, SMEs as we call them, in Africa, and show how Africa has faced severe economic consequences that disproportionately threaten women entrepreneurs and the disenfranchised communities they serve in Southern Africa. Our distinguished panelists will highlight the crucial work that is needed to create a full, healthy, and sustainable COVID-19 recovery. Our discussion will be anchored on these 4 key points. First, the current COVID-19 situation, economic implications posed by the pandemic's compounding impact on women, their families, businesses, and communities. And lastly, opportunities to bolster economic recovery efforts in Southern Africa. Now, I don't expect that we will solve all the problems in this 1 hour, but it is my hope that we will pick your interest sufficiently enough to get involved in the work of Shared Interest and be a part of a solution for an effective recovery response. So allow me to set the stage with a brief overview of the current global situation of COVID-19 and with a particular focus on Africa. As of June 28 worldwide, there have been over 540 million cumulative cases of COVID and over 6 million COVID-related deaths reported to WHO. In Africa, according to WHO, there are over 9 million reported cases and about 173,000 reported deaths. In South Africa, WHO reports almost 4 million confirmed cases and about 100,000 deaths since the pandemic. So you can see that South Africa alone represents about 44% of the reported cases and almost 40% of COVID-related deaths in Africa. While the overall burden of the pandemic has been relatively low in Africa compared to developed nations, the overall economic impact has been severe, and you will hear more about that from Trevor. But let's first of all start talking about people's response to vaccination. Effective COVID-19 vaccines have been developed and available, but many in Africa have either refused to be vaccinated, encouraged by global misinformation and social media. We have seen general mistrust and lack of confidence and safety in vaccines, particularly in Black communities. We saw a mistrust of these vaccines and the government. The vaccination experience, discrimination, and mistreatment in healthcare resulted in an outcry of systemic racism. So I'm turning to you, Faith and Trevor. Is there ongoing COVID-19 vaccine hesitancy in the Black community? Has it changed? And what is your opinion? In your opinion, what's the reason for that change? What can we do to mitigate these kinds of mistrust moving forward? So I'm going to turn this over to Faith. Do you want to get us started?
Thank you very much, Joan, and thank you for inviting me to this panel to share interest. Yes, I think you are correct. I think initially there was definitely high levels of hesitancy towards the vaccines in South Africa. And unfortunately, the picture has not really dramatically changed that much, because right now we still have got we've got less than 35% of the adult population being vaccinated. However, when you then look at the 50 to 60-year-old group, we do have a higher level, which is close to 60%. But I think what really provided that turnaround at the beginning, when government and civil society realized that people were not taking into the vaccination, there was that collective response to the crisis. So we saw government, private sector, and the civil society coming together to really educate the communities about the effectiveness of taking the vaccines, emphasizing the science. So I think 4 things were done well, in my view, to respond to the hesitancy. It was 1, underlying that vaccines do work. And number 2, which was very critical, was to take the vaccines to the communities. So we saw government working with the private sector, opening a number of vaccination sites and taking the vaccines to the community. And that definitely shifted the tide. We also saw a lot of education and communication, and again, also targeting specific demographics, targeting the older people, and then later on targeting also the younger people. So the tide did turn, but unfortunately, the vaccination levels in South Africa are still very low. Thank you.
Thank you. Trevor, any thoughts?
Thank you very much, Joan, and thanks to Shared Interest for convening the panel and for inviting me to join. Can I just take a Pan-African view before coming to South Africa? And this is that before you can get to vaccine hesitancy, there needs to be vaccine availability. And the work we did for the African Union was very illustrative in this regard. Part of the difficulty was generally, I think, about communication. Across the continent, we know that there was virtually an entire lockdown in anticipation of the pandemic that would wipe all of us out. And it wasn't matched by what actually happened on the health front. So you had a situation across the continent where everybody was locked into their homes, and there was no economic activity. And if you look at across the continent, country by country, at what creates economic activity, it's things like mining, tourism, trade, remittances and all of these were shut out. And so there was just starvation because the capability of government to provide support was not there. Across the continent, the majority of people work in smaller, medium, or micro enterprises and are day waged. And without income, there was just nothing. And so there was incredible hardship, which I think has a very long tail on the African continent. In respect of vaccinations, I'm going to be less generous than Faith has been. My own sense is that even here in South Africa, we didn't have communication that was properly tailored. I think it's very important to deal with hesitancy by having the information available in vernacular languages. And if we look at the mortality stats for South Africa, Joan, the WHO talks about 100,000, give or take. In fact, there's a different number, which is close to thrice that, because the 100,000 COVID deaths are primarily people in urban areas who were diagnosed with COVID. But if you look at the same age cohort, and it tends to be people above the age of 60 for 73% of mortality, there's an additional 200,000 people considered excess deaths for the period, for the 2 years of COVID, but who weren't diagnosed because they couldn't get to a health facility. So I think statisticians are looking at that and making the assumption that those were COVID deaths as well. So we're looking at a number of 300,000, which is very significant. Now, it's an important point to make because one of the issues across the continent is that we don't have adequate data collection. Official statistics are hard to come by, so we don't actually have something to mirror it. And all of these factors need to be taken account of as we develop an appropriate response going forward. Let me stop there. Thanks.
Thank you, Trevor. You've mentioned a number of different things here that are really critically important. You talked about the issues with data, because having appropriate data helps inform the strategy, helps inform what we do. And I think in the absence of those data, decisions may have been made that did not necessarily serve the communities, did not necessarily serve the populations well, is what I'm hearing you say. And that there could have been things done better in that respect. And as far as the misinformation, how could that have been addressed better? Because communications did go out, right? You mentioned that they were not tailored. But the fact is that there was misinformation. But the information in the midst, you had more misinformation than there was correct information. What could have been done differently?
Look, I think it's moot. One of the issues that I'm convinced of is that countries that had dealt with health issues intensely in the past, like countries in West Africa that had to deal with Ebola, were actually better prepared to deal with the COVID pandemic because a lot of the health communication was very direct. When everybody's locked down, who gets to do the talking? And I think that one of the issues that arose, certainly in South Africa, is that for the first time in democracy, the army was on the streets. And people saw it as an act of repression rather than something that they needed to embrace. And that created all manner of difficulties. When I think back of where the world was just over 2 years ago, when the US was talking about warp speed or something, for the rest of us, nobody quite knew what the next play would be. And people, I want to emphasize the point that people found themselves confined to homes without food, without income. It was a very, very difficult period. And I'm just going to get one additional point in because it's important for the purpose of this discussion. When people were confined to their homes without food, in circumstances that don't lend themselves to a lot of leisure, one of the outcomes was that there was a very significant increase in gender-based violence. It's not something that one computes into the measurement of a health challenge, but it certainly was a reality, not just in South Africa, but I think in many parts of the African continent. And it's something we need to understand. I think that before the next crisis hits, it's one of the issues that will require massive education to ensure that it can be eradicated from society.
Yeah, thank you, Trevor. And you're starting to touch on something that we are going to, and I see Faith also nodding. You're starting to touch on something that we're going to address later on, gender-based violence in the context of this crisis, because people are locked down. So I'm going to move on to another aspect. You start talking about the effects of lockdown, worsening poverty, unemployment, mental health issues, food insecurity. The pandemic also has significant effects on economies in several countries as trade, agriculture, and financial markets were disturbed. The IMF forecasts a recession of 1.8% across the region as a whole, the first since 1991, compared with its previous forecast of 3.5% growth. And so these SMEs have also been disrupted. And I want us to unpack what happened with these SMEs in Africa. Faith, Trevor, help us understand what happened. Both at the national and micro level of economic instability, we've seen job losses, shuttered businesses, with the government showing slow to no response in providing assistance or resources. Was there a social class divide in the government's response? Faith, I'll start with you.
No, thanks, John. I mean, I think before we even answer the question, I just think that it's important for us just to understand how critical the SMEs are actually in the economy, specifically in South Africa. In terms of just employment, basically the SMEs employ between 50 to 60% of the country's workforce. They represent about 98% of the private sector businesses in South Africa, and they are responsible for, they contribute about 39% to the GDP in South Africa. So these statistics just indicate how important this sector is in South Africa. And unfortunately, as we will see later on, is that, the government programs that were put in place, during COVID were not necessarily tailored or fit, for this sector. So, some of the sort of like challenges that, for example, were faced, there was a study that was done by McKinsey recently on the SMEs. It indicates that only 6% of the SMEs that were surveyed by McKinsey actually were able to have access to the support, that was provided, by government. So we know that, most of the, SMEs, as Trevor said before, the economy was locked down. Basically in South Africa, in March, the economy shut down, and most of the critical sectors that are providing employment had to be closed. And, during that time, more than 60% of the SMEs had to close down, because they could not operate. And obviously the closure resulted in, a number of, a huge percentage of job losses. So, so we had that situation then where, the businesses were not operating. There were huge, job losses. And then, government did try to provide, some level of support through the unemployment insurance fund. They also provided a guarantee to SMEs via commercial banks. And they also provided, some, tax relief to SMEs. So SMEs were could not pay taxes for at least 3 months or so. But the reality is that the take up, for example, of that, the guarantee facility of more than 100 billion rand that was put by the government to support SMEs, the take up was only 20%. And really, if you unpack, that 20%, the SMEs, apparently their take up was probably less than 10%. So it just shows, John, that we really have to reset. We need to understand why that was the case, why all these measures that were put in place to try and cushion the SMEs during the pandemic actually were not fit for purpose. And I think the reality also is that most of these businesses were already fragile. So by the time the pandemic came, basically, it was the pandemic was just like, the last nail in the coffin, so to speak. So for us, to sort of like just react to COVID is actually probably, we must react to what COVID has done, but we do need to go back to the drawing board to say exactly what has happened over the past 25 years, at least in South Africa, since our democracy. All these policies that have been put in place to support SMEs, to support Black-owned small businesses, to support Black women-owned businesses. The policies are not working. So we really have to, debate and talk about what are we going to do differently. Thank you, John.
It's sobering to hear you just share some of those numbers. I think that this is something that as we go forward in the conversation, especially when we start thinking about solutions, it will be important to have at the back of our mind the numbers that you just shared with us, really sobering. I think before I come to Trevor, I want to turn to Ann. South Africa has faced a lot of disparity through the entire apartheid movement, working through challenges of the region's new democracy and now COVID-19. Yet shared interest grew out of the movement to advance racial, gender, and economic justice, and has provided tens of millions of dollars in loan guarantees supporting Black-owned businesses in Southern Africa. So how has this pandemic exacerbated the challenges faced by Black entrepreneurs and businesses that you serve? We've heard some of that from Faith, but it would be interesting to hear from you from a shared interest perspective.
Thank you so much, Joan. And I couldn't be more honored to be a part of this esteemed panel. I am the new executive director of Shared Interest. I am filling some really inspiring shoes left by my predecessor, Donna Katzen. But one of the reasons that this role, I think, is so critical right now in South Africa's trajectory is that I truly believe that South Africa is a resilient country, and countries within the region are resilient. I think that us in the Western world can learn much about a new democracy like South Africa in particular, because we have the opportunity to really understand how a pandemic like COVID-19 represents, as Faith said, and exposes already sort of pre-existing inequities. And so at Shared Interest, our unapologetic mission is to support Black-owned small and medium-sized businesses that we are sure will be critical to the COVID-19 economic recovery efforts in the region. And so how do we do that? A big part of what we are doing is to better understand, as Faith and Trevor have highlighted, these SMEs need to be at the table. They need to be co-creating the kinds of solutions that will allow them to thrive and survive and contribute meaningfully to the democracy, to their communities, to their families. And so just to paint a picture of what stood out to me, one of our program consultants Lloyd Guza Chinetsa, during my recent trip to the region, said, you know, what really is a cancer on SMEs is lack of access to capital. And I found that to be such an interesting way of painting the picture. I come from the American Cancer Society, where so much of our work was focused on fighting cancer and figuring out ways to reduce the burden. I never thought of lack of access to capital as being a cancer on economic hope. And I think that's what we need to really address, and address meaningfully, and address with some innovative solutions. I'm really excited about ways in which we can be doing this through technical assistance, tailored technical assistance that puts SMEs at the center of ways in which we can provide integrated and holistic financing solutions. One of our businesses in particular that was impacted by the pandemic is one that still, stands out to me. It's a small women-owned business that had launched a sanitary napkin enterprise in South Africa. The business had gotten its finances right before the pandemic hit, and there was so much interest in this small business to address menstrual inequities in the country, doing some real education around the importance of making sure that the girl child and women have access to affordable sanitary and menstrual supplies. Well, when the pandemic hit, she was not able to see her business thrive. Why? Because the contracts that she had with the store that she was hoping to really showcase her product and wasn't able to honor the agreement. She was not able to do the kind of marketing around this business. Yet we know during the pandemic, there was such an economic devastation, particularly to women. What happened when these women didn't have access to affordable menstrual supplies? So those are the kinds of businesses that Shared Interest is trying to come up with access to capital solutions for. But it has to start with really understanding what their business needs are, ways in which we can provide the kinds of technical assistance that will allow them to speak meaningfully and effectively to financial partners. And that has to start with understanding what is the impact that these businesses are trying to have on their communities. And so I could go on and on and on, but I think that Can
you all hear me?
We can hear you.
Yeah, we
Joan.
lost Ann.
I think we lost Ann. So while Ann is trying to reconnect, when you hear Trevor, and I'm going to turn to you. So when you hear Ann say lack of access to capital, that these women lack access to capital, I dare say that these women have always lacked access to capital. And the pandemic only just exacerbated their lack of access to capital. So as an economic expert, what do you say to that?
Look, I think there's an enormous challenge, and one of the points to make, just to amplify something you said earlier, Joan, so many countries were driven into a recession for the first time in 25 years, and you've had a constant buildup of better policies across the continent, and COVID-19 just wiped everybody off the slate. And within that, I think just take account of one little indicator. By 2019, there were 16 countries on the continent spending more money on debt service costs than on the combined spending on public health or public services, education, health, etc. Now that's a deep tragedy. And one of the things that we did for a period was a debt suspension sustainability initiative, the DSSI, which we were able to take to the G20. Eventually, the IMF carried it. And so countries were spared. But by December 2021, the DSSI was lifted and debt service costs reintroduced at full blast. And this means that all of this money flows off the continent. Now, it's a fundamentally important point because it weakens the ability of government to render quality services, including support for small, medium, and micro enterprises. The point about SMMEs is that, unfortunately, in South Africa, because of a long period of intergenerational bad education designed by apartheid, people who engage in entrepreneurial activity frequently are on the survival end. The skill sets are just not in place to do startups as you see in many countries. You look at the profile of startups in equivalent countries like take India, Brazil, Mexico. Frequently, the startups can happen because there's a skill that then gets built up, taken out of the factory and into the realm of entrepreneurship. If you don't have that, then many people engage in survival activities, and I'm sure Faith will be able to confirm this. The survival activities might be as basic as finding a street corner where you can then trade tomatoes every single day. And that puts some food on the table, but it'll never grow or make you comfortable. And when you have the hardship of a lockdown, that kind of trading stopped. And the only way, and I think it's something I'd like to come back to, so let me just plant the seed for this, Joan. When there's no income, and before those government systems kicked in, people had to go back to the loan sharks to borrow. And so it's not just about survival once the pandemic has passed, it's also about having to generate a resource to repay the loan sharks because the interest rates are usurious. And so if you don't have mechanisms in place that assist people and assist them in the short term, the impact of COVID will have an unbelievably long tail. You see, the point about poverty is that it places families in a very precarious situation. It takes something small to tip people into very deep poverty. It could be a funeral. It could be the loss of employment. It could be the loss of a crop if you're in agriculture. It could be the theft of your inventory if you are a trader. It pushes you into deep poverty, and the only resort that you then have is to the loan sharks. It's a terrible, cruel situation that impacts much, much more on exceedingly poor people and exacerbates the inequality that you referred to earlier.
Thank you, Trevor. You've unpacked a lot of things in there. When you mentioned the loan sharks, what first came to my mind was the fact that if governments are focused on making loans available to support the businesses, sometimes those loans may be coming a little too late because these women are already in debt to those loan sharks. Now they have their first priority would be, how do they pay that money back? How do they support their families? How do they feed their families before they even think about sustaining the business? And I see Faith nodding. Share your perspective on this, because I think this is truly the heart of the issue that we're dealing with.
Yes, and I think also it's just important for us, as Trevor has said, to sort of like unpack what we mean by SMEs, and specifically then when we speak about where do women, and specifically Black women, sit in this pyramid of SMEs. As Trevor says, most Black women actually are sitting at the bottom end of the pyramid, i.e. in a survivalist area, which is basically, so when COVID hit, those women that, either, running small spaza shops, or they're selling peanuts by the road, their businesses, had to stop. And unfortunately, for them, those businesses are supporting the families. So it's not like, they have a choice, they have to work, because if they don't wake up in the morning and go and sell oranges by the road, the kids are not gonna eat. So I just want to underline that, when we're trying to design solutions here, going forward, to really address, some of the real issues or underlying causes that, Trevor has mentioned, for example, poor education, poverty, poverty levels that are just, not going to be obviously addressed even in a generation. We really just need to make sure that we're designing solutions that take into account, the various segments within the SMEs, the survivalists, then we've got micro businesses, then we've got small businesses that at least are employing maybe, 2 to 5 people. And the needs of these various segments are quite, unique and different. But I think the issue of access to finance obviously cuts across. And this is where then you find these businesses going to the loan sharks, to try and fund their businesses, because, banks, development financial institutions, and even government, they don't necessarily have got the instruments that are fit, for purpose. Because also, again, it's not just about providing financing. It's also about providing business development support, non-financial services, training and development, of these businesses, and also for the large corporates to open their supply chain and procure, from these small businesses. So it's John, it's quite complex, but it doesn't mean that we cannot come up with solutions that are tailored. But we need to understand that, we really have to deep dive for us to come up with solutions that will work for the various, segments within this area.
So thank you, Faith, because you have taken us into the solution realm, and that's great. So I'm going to turn to you, Trevor, and thank you, Ann, for joining back in. Trevor, you've heard Faith talk about some solutions that she thinks could work. We know that women are nurturers, and a woman would sooner forgo her business to take care of her family in times of need and crisis. So from an economic, perspective, as an economic expert, what can we do? What else can be done to support these women so that they don't have to make that choice between family and business?
Thanks. I missed out responding to your question before, and I'd like to go back there. There are, to my mind, 3 access issues that are fundamentally important in the support of small and medium enterprise and micro enterprises. The first is access to finance. And access to finance is tough because the requirements are so small and the administration costs therefore increased. And it's something that we haven't quite cracked. And your wholesale finance institutions needs intermediation that can actually get to people on the ground. Unfortunately, because the loan sharks provide access, it may be unbelievably expensive access. They are utilized because there's frequently nothing else available. So it doesn't matter if government's sitting in Pretoria or in the provincial capitals. That's actually not where the resource is needed, and it's one of the issues that I don't think we've cracked successfully. So access to finances is the first of those. The other is access to product. Now, it doesn't make sense to go down the road to the South African equivalent of Walmart to buy and add a little markup and hope to survive off that. Access to product is actually a fundamentally important issue. And what we saw during the pandemic as well, that some of the market changes as micro enterprises were transitioning, they could then sew things, so school uniforms, church uniforms, and so on. And what happened in the pandemic is schools closed, churches closed, and the market shut down for those kinds of issues as well. And I think it just impacted very, very severely because those are big, big issues. So I'm saying it's access to finance, access to product, and even where there's innovation, access to market, and markets were shut down during the pandemic. And if people, you see the problem, and I want to emphasize this point about precarity, because if you start with a small loan from whomsoever, you get by from day to day. It's a survival activity. Then you stop selling because the market shuts down during the pandemic, but your interest burden doesn't shut down. It continues accumulating while you have no revenue. Mm-hmm. So at the end of it, even if you were merely surviving, at the end of a process of, and call it 2 years in the context of COVID, you end up much poorer than you started. And even if you did have a credit score with financial institutions, it's wiped out completely. So you end up with far less than you've ever had. You see, these are the issues that I think, Faith, we need to talk about as a nation. We need to look each other in the eye and ask how you will crack it, because as you pointed out, at the start of the pandemic, government moved in the right direction, but the mechanisms and the transmission mechanisms to get them into the hands of poor people were not adequately attended to. I think uniquely in South Africa as well was the Solidarity Fund. And so businesses and people who are sort of earning more committed a resource to a solidarity fund that did all kinds of very interesting things, including getting food parcels to poor people, helping small and medium businesses just stay on the road. I think it was a unique opportunity of social solidarity that was expressed, and the Solidarity Fund was birthed in April of 2020, and I think it signaled what is possible. The question now is whether there's the wherewithal to carry the same spirit forward. And I want to end on this point. When we're in that battle to secure vaccines on behalf of the African Union, the big concern that we had was that countries in the north would have picked as many vaccines as they could. They could afford it. Intellectual property made the vaccines more expensive than they needed to be. And when they had their fill, trying to secure vaccines for Africa that still had some shelf life left was going to become very hard. And I think that has been proven to have been the case in the management of vaccine distribution. These issues all interact and intersect in a very, very distinct way. And I think it's quite important that the takeouts from the 2 years of COVID now get applied to what happens in the lives of people going forward.
Thank you, Trevor. Your last point about vaccine supply availability, and I'd like to bring in the context of demand. Because from when we started this conversation, we were talking about vaccine hesitancy, lack of confidence in the vaccine, and people were not lining up to get vaccinated. So how do you reconcile the fact that there really was not demand with your comments about supply availability?
Look, I'm saying it was a very difficult call. If you look at the age profile of the deceased in South Africa, very high percentage of those who passed away as a result of COVID, where the measurement is taking place, were older than 60. Now, That age cohort is reflected, as Faith said, in the very high vaccination rates north of 50. We haven't been able to get the message to younger people who always feel invincible. And that I think was one of the challenges. The distribution mechanisms, as Faith said earlier, just weren't always in place. But also, I want to emphasize the point, Joan, that in South Africa, government had set resources aside. The Solidarity Fund could put money aside for the acquisition of vaccines, but there were many countries across the continent that didn't have the resource. I couldn't tell you offhand. I know that COVAX didn't work, but if we were to compute the number of countries that were dependent on Sinopharm and Sinovac and Sputnik, you would understand that there wasn't a lot of scientific information to support what was being done. Bear in mind that there was a very high degree of trust necessary, because the normalcy of long cycles of the testing of vaccines was not a luxury that the world had. It was also new technology in mRNA and a lot more artificial intelligence in use. And this, I think, added to some of the skepticism. I mean, I think one of the worst challenges that confronted the world in vaccination was, and I don't want to offend anybody, but some of the Pentecostal movements were actually unbelievably negative, arguing. We had a Chief Justice who argued that they inject the devil into your arm. A 666 gets put in your arm, and you will go straight to hell if you're vaccinated. Now, if somebody of high standing in society says these kinds of things, then it has a major impact. And politicians don't have enough trust to start with to be able to take on those kinds of views. It's an unbelievably difficult challenge in exceedingly stressed circumstances.
Thank you, Trevor. And we're coming very close to the end of this conversation, really exciting conversation. And I wish we had more time to unpack some of these things. But all good things must come to an end. And so before I turn it over to Ann for some closing remarks, I want to give Trevor and Faith an opportunity to share with me, if you and the audience, if you had your druthers and you could wave a magic wand, what are the top 2-3 things that you would want to see happen to get this woman out of the hole that they have been dug in, and this women and their businesses and their families, to get them out of the deep dark hole that have been dug for them as a result of this crisis? What are the top 2-3 things? I'm going to start with you, Faith.
Thanks, Sharon. I think for me, it really all starts with the policies that we're putting in place. Policies now, I'm also talking about, even in the private sector. I think we need to have, policies, processes, and systems that are inclusive and that have got a gender lens in them. Without that, we can't then really start to understand what solutions we need to put in place. That's number one. And I think the second one for me is that when it comes to designing those policies, we need to have women being present. Because, too many times, and our government is very guilty of that, too many times these sort of like programs, policies and solutions are put in place by men without women being involved. So we need women to be involved in shaping a new or a post-COVID economy in South Africa. I think the last one, Joan, is that we also, as we know, in this SME ecosystem, There are so many things that are going on. There are so many stakeholders. There are so many people that are trying to do the good things. But there is definitely not much, integration, collaboration, whereby, the various programs and solutions that are being put across to deal with the challenges of the SMEs are actually being addressed, in a coordinated manner. So I really believe that if we can also find a way to coordinate better, to integrate better, to integrate the ecosystem, we can also get to solutions that then work and are sustainable in the long run.
Thank you, Faith. So I heard you say policies that are fit for purpose, women involved in shaping a post-COVID economy, integration and coordination. Trevor, 30 seconds.
Thank you, Joan. The first point I want to make is that we're not quite in post-COVID because the impact of the Russian war in Ukraine is manifestly important and impacts on many of the issues that impact in women's lives. Food, fuel, fertilizers, the costs have all been increased very rapidly, and it pushes people even further into poverty. And so we need to understand that issue in the context as well. There are a couple of issues. I agree with what Faith is saying about the fact that policies are not gender neutral, and they need to be tilted. But the big issue is that mothers frequently take responsibility for, as you said yourself, Joan. Hunger is a big issue that women take responsibility for. A second issue that I think is paramountly important is the future of the girl child, because remote learning during the pandemic meant that the children of the poor didn't have access to computers and so on, and they were driven further and further away from being educated. If you look at the number of children across the African continent who haven't returned to school, and the number of girl children who haven't returned to school, it's a major, major setback. And the third issue I want to repeat is gender-based violence. Mm-hmm. We need better women's organization, better voice, and I think that society must do a lot more listening to women articulating these kinds of issues and ensuring that policies are actually fit for purpose. Thank you. 30 seconds.
Fantastic. Thank you, Trevor. And I want to underscore that point about gender-based violence. We saw a lot of it during the pandemic, and we need to do more as a community, as a society, as people to address this plight of women. So I'm going to turn it over to Ann McMikel to take us out to the close.
Thank you, Dr. Benson. And what can I say? I think this kind of a convening, we need to have more of them. I think we need to really be committed to listening to the solutions that small and medium-sized enterprises have, that they just don't have the platforms to share. So at Shared Interest, we've been spending a lot of time both with our updating of our strategic plan and really sort of looking at what is it that we as an organization can do to further empower Black-owned businesses that will be a real critical solution to some of the more innovative ways that we can recover from COVID-19. And so one of the ways we are trying to provide solutions is we launched a COVID-19 relief fund that will support our beneficiaries in some really targeted ways. We are not a granting organization. We provide guarantees that support businesses, but because of the extenuating circumstances that COVID-19 represents to our community and to particularly the businesses that we serve, it was important for us to step up and provide resources in a slightly different way. So we have a COVID-19 emergency relief fund that provides the kinds of support to our businesses that will support the kinds of due diligence assessments that are important for our businesses to identify opportunities for growth and for survival. This fund will also support the kinds of monitoring and risk mitigation measures that will hopefully keep businesses from having to shutter. And also providing very basic supplies around PPP. So this relief fund is really meant to be one of the ways that we are trying to provide resources to the businesses that really want to be solutions and provide impact in their communities. The other opportunity for us is to really partner more strategically. I think NGOs and financial institutions and banking institutions and microfinance institutions, they're all pieces of a really important puzzle that need to come together synergistically to support these kinds of businesses. And support means mentorship. Support means, of course, resources, but support also means the kind of capacity building that businesses need to not only survive, but thrive. And so Shared Interest is very much interested in, through our new model, partnering more effectively with the sectors that will be critical to the kind of recovery that will be important for Black-owned businesses. And lastly, I just want to give a important plug to an opportunity for us to rally around the SME community with a gala that we will be organizing later this year. We believe in taking an assets-driven approach to our work and celebrating the successes of Black-owned businesses. And so our 28th annual gala will do just that. We will be recognizing one of our beneficiaries out of Zambia, Indie Credit. We will also be having a special focus on sustainable tech equity. And we are so pleased that we will have a few well-known musicians to provide inspirational entertainment. India Ari and Simpi Waydana will be providing soulful sounds and inspirational messages that will all convene together to pay a special tribute to Archbishop Desmond Tutu, who served as our chair of our National Board of Advisors. So Shared Interest is very interested and committed to seeing a way forward that allows us to celebrate successes and highlight ways in which we can empower the Black-owned businesses that are so critical to a full COVID-19 recovery. Thank you.